Humor is a coping mechanism. It's how people work through pain, actually. But I wasn't very funny when I was laying on my back crying. I would use my kitchen chair as a walker at some point, and then just wait for that to settle down and move on, and you just learn to deal with the pain. It's an everyday pain, and that's just your norm. When I was 24 years old, I got into a car accident. Before that, I was riding the bike path, which I think is like 13 miles, 3 times a week. I was a certified aerobics instructor, and I was very active. I had a lot of pain from the accident, and I got married and I had a baby, so I had gained 100 pounds. They tell you you're eating for two. I ate for a third world country. And from there, I lived with the back pain. It was chronic, and I lived with it for about 21 years, having bouts of acute pain, and learned to tolerate and tolerate and tolerate. And I went to acupuncture, tried yoga and every other type of pain management. I'm not fond of medication, so it was very difficult, and there were days that I couldn't get out of bed, and it was very hard to walk.
Her car accident may have played a small role at some point, but the reality was she had a very common problem that we see in orthopedics and that we see in orthopedic spine surgery, and that is basically arthritic deterioration of the lower aspects of the spine, or the lumbar spine.
My back started to feel worse and worse and worse, and there were sharp pains in my back, and I knew that it was different. I had more numbness going down my leg, and I made a phone call. I had asked for referrals, and I made a phone call to University Orthopedics and got in touch with Dr. Palumbo.
She had the specific structural and clinical criteria that would say, listen, surgery is a good option for this individual. But then there's the other set of variables that are so hard to grasp, things like motivation, things like pain threshold, good attitude, and a person who really wants to live life to the fullest. And when you listen to Coleen, you can really get that sense very quickly that here's someone that, listen, I do not want to be slowed down by this. I'm going to do everything I can to fight through it. Coleen had a combination of problems. One was structural breakdown of the lower two segments of her spinal column, basically in relation to arthritic change, or what we call spondylosis, or degenerative disc disease, with the secondary or coexistent problem of nerve pressure, what we call spinal stenosis. So any operation to address this particular problem has two objectives. One is to remove the pressure from the nerve structures. By doing so, you can generally help alleviate the symptoms that Coleen described in her legs: pain, numbness, weakness, and a common complaint is intolerance of the standing position, the upright position. So first and most critical aspect of the procedure is, again, what we call the decompression, taking the pressure off the nerves. Once you do that, then you can deal with the second main problem, which is the loss of structural integrity or stability of the lower spinal column. And that involves a process of what we call spinal fusion, which we use a combination of bone graft and then instrumentation, which hardware, screws and rods that are implanted very much like an internal brace for the spine. And I think people can understand it well that way. It's restoring stability to a part of the spine that had lost its ability to serve as the foundation of the torso, if you will.
When I had this surgery, it completely changed my life. I could feel the difference the first time that I actually got out of the hospital bed. I still had surgery pain from the surgery, but the injury itself, where I had felt 21 years of pain, it was almost like one of my relatives. It was gone. I could feel the difference. That actual pain was gone. There wasn't the pressure on the nerves, which was a huge issue. And and working through the recovery process every day just got better and better and better. And I was able to move on to go back to kickboxing and hiking and dancing, which is one of my loves. I hiked Machu Picchu 6 months after my surgery, which is a 27-mile hike, mostly up, and it's all stairs. They don't tell you that in the brochure. But I was able to hike it, but I am also able to dance at a different level than I did before. You know, my range of motion, my balance is so much different, and also the intensity of the dancing is a lot more difficult.
Not everyone has the same degree of benefit that Coleen has, so when someone does fully take advantage of the treatment that we've provided and can really get back to their life, I mean, it's the best feeling, it's the greatest level of job satisfaction you could ever have in terms of helping someone else, you know, get back to their own life.
From the moment that I came into the office until afterwards, I mean, even the follow-up visits, he has just been so caring and understanding, and has always been very supportive. The level of care was so incredible. So I just have to say thank you very much to everyone at University of Orthopedics, especially Dr. Palumbo.